Dr. Peter McCullough joins us now to discuss further. Dr. Peter McCullough, thank you so much for joining us today. We appreciate you being here.
Thanks for having me.
Of course. Well, I recall some time ago, this peer-reviewed study on the autopsy findings, you and I interviewed about it. It was censored and it's finally been published. Talk to us first and foremost about the struggle to get this published and the findings of the study.
Several years ago, we set out to collect all the autopsies done on people who had died after COVID-19 vaccination. And so we assembled this database from all over the world, gathered the separate autopsy findings, and then set a team to independently adjudicate the findings, and then essentially attribute cause of death either to the vaccine or to another cause. This is important because at the time the studies were done, it was very early on, the autopsies were published, a lot of the side effects weren't known. They were later on found, so it needed that retrospective view. And so we put together the project, and it was presented in person at the American Society of Microbiology in Atlanta, Georgia. So this actually met peer review for a major, conventional medical meeting. And so it was presented there by myself and McCullough Foundation fellow Nick Hulscher. But when we went to publish it, it was astounding. We had submitted it to Lancet, and we utilized their preprint server as the first step, the SSRN server. And so it went through these administrative checks, found to be okay, and then it was posted on the Lancet preprint server. And it received massive downloads and views overnight. And then the next morning, Lancet removed it without any real reason. It had met all its checks to be, a valid paper on the preprint server. And, people understand preprint is not peer reviewed. And so that, ethical skeptic and a lot of other media agencies picked this up and said, why would Lancet suppress such important information? So we published it successfully on the preprint server and for European Commission Zenodo, and then we moved on through the peer review process. And it was paper after journal was either not sending it out for review, or its editorial board was refusing to handle it. Its findings were so compelling that the vaccine was the cause of death. I think it disturbed so many of the journal editors themselves who had probably taken the vaccine. So finally, it was fully accepted and published by Forensic Science International. And then the same thing happened. It got tremendous amounts of attention. And then within a day or two, Forensic Science International said it's taking it down, it's retracting it. Again, for no specific reason. So we set about yet for a third time to fully publish it, and it was finally published in the journal Science, Public Health Policy, and the Law. So that's the sojourn of an analysis regarding the vaccine as the cause of death.
I just find this astounding. I had a little bit of a look as to when it was that you and I spoke about this. I interviewed you back in July of 2023 on this particular subject. So we are talking over a year, almost a year and a half of something that is literally life-saving information being suppressed from the people. This is criminal, in my opinion, Dr. McCullough. What do you think has been the major shift? Why have they now allowed this information out? Is it because of the incoming administration, RFK Jr.? Are they starting to speak more freely about these things?
Well, it's possible, although Dr. Jack Lyons-Weiler, who's the editor-in-chief, former University of Pittsburgh professor at Science, Public Health Policy, and the Law, he made a courageous decision to accept this paper for publication. But I can tell you that, that journal is uncorruptible. But the other journals appear to be completely corrupted by the biopharmaceutical complex, that they're being influenced, even after papers are fully published, they're being pressured and influenced to retract papers that go against this false global narrative that the vaccines are safe and effective. the public knows the vaccines aren't safe and effective. The evidence, the prima facie evidence is clear, this paper being one of now thousands of papers, yet the complex doesn't want the world to know the truth.
It's just unbelievable to me. I'm sincerely hoping that this is going to start shifting. I mean, I have a glimmer of hope seeing that now it's being published and people are able to view this. But again, going back a year and a half almost ago, we were called fringe. We were condemned for talking about these things. You know, we'd be silenced on social media for talking about these things. And yet it was just as valid then as it is today. It's just that now someone's had the courage to publish it. That this needs to change.
I agree. We have to get corruption out of the peer-reviewed process. Editors need to receive papers, fairly assign them, get peer review, and get back to the standard processes. I've been an editor-in-chief now for 20 years at 2 journals. I've now started at a 3rd journal, retiring the other 2. And I can tell you, as an editor, I've never retracted a paper in my history of being an editor, because the peer review process, if done properly, is a valid review. Now, if people don't like what the paper has to say or have objections, they can write a letter to the editor, and that can be the process of letter and then rebuttal letter through carefully vetting it. It's, every manuscript published in Science and Medicine will have some opposition. That's normal, and we should have discourse on it, normal scientific discourse. But to censor papers and suppress information, essentially bending the truth towards one biased viewpoint, is unfair, it's misleading, and actually it's setting scientific process backwards.
Well, absolutely. And I think we saw a recent example of this again that sort of made major headlines, where there was a study that was being withheld during the election season that was showing how harmful gender transition medication, not that gender transition is even possible, but, gender bending medication being given to young people, or even these surgeries, were actually detrimental to them. But that was withheld because they felt that maybe this would be detrimental to the election season and Kamala Harris, for example. It was a politically charged environment. You can't withhold information that could save children's lives just because it's going to upset some people. I mean, this, as I said, this just has to stop. It absolutely has to stop. The other topic I wanted to discuss with you, Dr. McCullough, was the heavily vaxxed county facing a grim reality. King County's 2.2 million residents have seen am I reading this correctly, 1,236% surge in excess heart attack deaths?
You are. This is grim news. Now, I did my internal medicine residency training at the University of Washington in Seattle, so I know the city well, and I know the paramedic system, which is really a storied emergency medical response. Medic One, they're the lead paramedic agency in the United States. They keep pristine data on every cardiac arrest in Seattle. It's a very tight community in King County. And what we learned during COVID is that the population of Seattle stayed the same and actually went down a little bit. So it didn't grow. But what did skyrocket was cardiac arrest, starting with rollout of the COVID-19 vaccines. And that figure that you see is the rate compared to the baseline. And it absolutely skyrocketed. Importantly, not only did the number of cardiac arrests go up, but the fatality, or that is the lethality of the cardiac arrests, went up. The paramedics can save some individuals, but both the arrests went up and the deaths went up. And then what we found out is Seattle is 98% vaccinated, COVID-19 vaccinated. And so our great fear is that it was the COVID-19 vaccine and subclinical vaccine myocarditis that was the underlying cause of these cardiac arrests. And I think the immediate action item is that Seattle King County needs to get the vaccine records from the CDC and match these up to these cardiac arrests.
Dr. McCullough, a lot of people are hoping that within this new administration there will be accountability. People are hoping that we don't simply sweep COVID under the rug. In my opinion, and many others, this is the greatest crime that has been committed against humanity in history. More deaths from these injections combined than I think any other, I mean, many wars, for goodness sake. And so I know that people like you and other doctors have said, we're going to continue our battle when it comes to these injections. What are your plans moving forward? And how do you plan on keeping this at the forefront of everyone's mind?
I started McCullough Foundation, and I'm the president. We receive funding through donations, and people have been very generous. It's funded our clinical fellowship. We have done, critical work in the area, not only COVID, but also monkeypox, bird flu, transgender, all of these contemporary issues that are influencing people's lives. Every day in clinical practice, Maria, I am seeing patients with COVID-19 side effects, injuries, disabilities. We're seeing new heart failure, new strokes, new blood clots every day. People who took the shots back in 2021. So the story is not over with. What you won't see, though, is you won't see medicine grand rounds at any major academic institution on COVID-19 vaccine injury syndromes. We haven't seen any academic institution publish a protocol on how to detoxify from these vaccines. And again, that's where I've filled a void with McCullough protocol, base, spike, protein detoxification. This is a combined use at a base of nattokinase, bromelain, and curcumin. Then we add prescription drugs to it, other supplements. We now have a word that a first peer-reviewed publication demonstrating success will be forthcoming. I will still stand in this gap where the public needs to know what to do, just like with early treatment of COVID-19 and now management of COVID-19 vaccine injury syndromes. That's where I've made contributions, and sadly, the major academic medical centers have been absent.
Yeah, thank you so much, Dr. McCullough, and thank you to all the others who are still in this fight. There are many, many people all over the world suffering, and the medical establishment is just ignoring them. People are still being gaslit about their injection injuries, and I just find it absolutely astounding. But I see a glimmer of hope when we have studies like yours being published, and now the doors seem to be opening for more of these discussions. Can you please let people know where they can follow your work?
Well, I think everyone should get a subscription. It's free to Courageous Discourse Substack. That way you're updated every day on critical video information, the graphical abstracts, the publications, key news events. Make sure you listen to my podcast, America Out Loud Talk Radio, McCullough Report, every Saturday and Sunday, 2 p.m. Eastern. Then on the Apple iHeart podcast network after that, a McCullough Report. And then make sure you get on social media. You and I are social media mavens on Twitter, X, and all the other social media platforms, P_McCullough MD. We'll continue to work together to bring the public the truth. And you know what? They know it.
They sure do, and they're terrified of it. But we are not going to give up. Dr. McCullough, very, very grateful for you and your time today. Thank you.
Thank you.